My name is Mary Ann Young, and on behalf of Iowa Caregivers, I want to welcome you to this Mouthcare Matters in-service. Mouthcare Matters offers training, both in-services classes as well as educational resources in the area of oral care. Mouthcare Matters was developed by Iowa Caregivers with funding from the Delta Dental of Iowa Foundation and the Iowa Department of Public Health. University of Iowa Colleges of Dentistry and Nursing participated in the development of this program, and it also is an initiative of the Lifelong Smiles Coalition, which is part of Delta Dental also. This program was originally designed for direct care staff, such as home care, hospice, nurse aides, personal assistants, and others who deliver direct care, but the program is also suitable for other healthcare professionals, including licensed nurses and dietitians. This oral care in-service is designed to help you understand the importance of good oral care, the impact on our overall health, the importance of infection control, and other issues related to oral care. This particular Mouthcare Matters in-service is made possible by funding from Central Iowa Works and in-kind contributions from the University of Iowa College of Dentistry. For more information about Mouthcare Matters, please visit the Mouthcare Matters webpage at www.iowacaregivers.org, or you can email Iowa Caregivers at information@iowacaregivers.org. I will now turn to Robin McNeil, a registered dental hygienist and a certified Mouthcare Matters instructors, to continue the in-service. Thank you.
Hi, everybody. My name is Robin McNeil, and I am coming to you from the University of Iowa College of Dentistry. I have been a dental hygienist for over 20 years. My position here at the College of Dentistry is in geriatrics and special care needs. At the college here, the department that I work in serves adult special needs patients as well as the elderly. Part of my job is to serve patients here in the clinic, and then the other portion of my job is to go to nursing homes throughout the area. We serve about 10 nursing homes and perform dental screenings, oral care, oral hygiene consultations, and fluoride programs. Today's program is going to be on oral care, the connection between your mouth and your body, and give you some overall skills and knowledge of what to look for with your residents on a daily basis. So this first slide, we're going to talk about oral health status. This is some statistics that were found back in 2012. This was a survey, and it surveyed homebound versus nursing facilities. And you'll see some of the percentages in here of what we found for people who needed care, what kind of inflammation they had, what types of dental care they need. And I would say this is pretty true to what we see. It depends on the nursing home and the stage that the patients are in. The severe gingival inflammation, you'll know, is 26%, which may seem high to you, but I would say all of the patients that we see in a nursing facility have some kind of inflammation. It's very few people that we actually see that have a healthy, completely healthy mouth. And so, like I said, today's presentation is going to be talking about the mouth and how it impacts the rest of our body, and how having a healthy mouth can make our overall health much better. So why do we need our teeth? Well, if just looking at some people who are famous, and if they didn't have teeth, how different they would look, and probably how different that we would perceive them. And so there's many reasons why we want to have good oral health, but here are some of the major ones that we look for. We want to be able to have good nutrition. We want to be able to digest our food, enjoy our food, speak with others, feel good about ourselves, maintain our appearance, and smile. And these goals are the same goals that you'll see with our nursing home residents. They all want to be able to eat. They still want to enjoy their food. They want to be able to speak clearly. And this is so important as they have health. Sometimes they'll have health issues that impact their speaking. And we want to be able to know that it's not because of their oral health. And they still want to be able to smile and look attractive. So now we're going to talk about what goes on in your mouth. So there's germs in your mouth. When you go to the dentist, you hear a lot about plaque. So plaque is that sticky, colorless material that forms on your teeth within seconds after you eat. So you can probably tell in short order after you eat, if you ran your tongue along your teeth, they would feel sticky. They would kind of feel fuzzy, and that is that plaque. If the plaque is left there long enough, it will become thicker and it will become white substance material. If it's not brushed off, that bacteria that's harbored in that plaque then becomes what the bacteria buildup that causes cavities and causes gum disease. So here's a breakdown of tooth decay. First, you get the germs, that plaque, they mix with the food you eat, they produce an acid, it hits the tooth, and then if it's not taken away, that acid forms on the tooth. And one thing I like to point out about this slide is looking at the food. So we talk a lot about sugary foods or the foods that are bad for you that cause cavities. Well, there's also regular snack foods as well, like for instance, those crackers. And this is important because in nursing home residents, they don't have the saliva and the chewing ability to move those foods through their mouth and get all of it swallowed. So that sits on their teeth. So it's important to know that it's not just because they're having candy or dessert. It's any caused by any food that's left to sit on your teeth. So now we're going to talk about cavities and what matters about cavities. So again, the types of foods that you eat matters. How long they stay on your teeth matter. For instance, if you are going to eat watermelon versus you are going to eat peanut brittle, two very different scenarios. So the watermelon is going to be watery. They're going to be able to chew that up somewhat easily. It's going to be swallowed pretty easily. The peanut brittle, that's going to stick in your teeth, stick in the grooves of your teeth. It's going to take hours for that to get worked out. And you may even still have to floss it out later that evening. So that's going to sit there and form on your teeth all day long. Frequency. So take the scenario of drinking a Mountain Dew. We'll pick on Mountain Dew. So if you're going to drink a soda, it is much better to drink it down in a short session than drink some, come back a few minutes later, drink some more. That sipping, that frequency, you're just re-adding that new acid to your teeth each time. So again, the frequency and the form of the food both matter. Obviously, you want to limit eating the really sugary, starchy stuff, but we all eat it. So you just have to know what to do best for yourself. So gum disease, we're going to talk about gingivitis and gum disease. So on the left side of this picture, you're going to see healthy gums and healthy bone level. You'll see that the gum tissue is pink, it's pointed, the bone level is high upon the tooth. On the right-hand side where the periodontal disease is, you'll see the bone levels are lower. The gingiva does not look healthy. You'll see the bacteria, the plaque, the hard deposit built up. That's the main differences there. With gingivitis, that is an acute situation. That is an inflammation response that can be reversed. Once the gingivitis becomes advanced into periodontitis, and you might wonder, well, how does that happen? Well, if the bacteria is left there and not disturbed, the bacteria then that forms even more is more complex than that initial bacteria onset. And that advanced bacteria becomes periodontitis. Once you have periodontitis and you have that bone loss, it is non-reversible. It is yours for the rest of your life. So obviously we don't want anything that happens in your mouth to stay in your mouth. We want everything to get cleaned out of there as good as possible. So the next thing we're going to talk about is the oral health systemic connection. And one thing I like to point out about this slide is look at all the arteries and veins in this body. And you see it goes from your head all the way to your toes, all your extremities. And so when we talk about inflammation response and how it travels through your body, it travels to all of these places. So that same bacteria that builds up on your teeth, guess what? It goes through your whole body, that inflammation response. So it doesn't just stay in your mouth. So here's the process breakdown for you. Germs from unclean teeth can enter the bloodstream through infected gums, and you'll see the arrows there pointing at the infected gums and that red tissue. And then that infection, because it's not getting better, it's not being cleared up, that travels through your whole body. So it affects important places like the brains, the kidneys, the joints, the lungs. And so for someone who is elderly, this is very important because they are already immune compromised. And so this infection in their mouth cannot stay there because it will compromise the rest of their body. So this slide is an important relationship between bacteria in your mouth and other bacterial infections. So that same infection that you see on your skin. So if you saw this infection on a resident's skin, you would see it, you would note it, you'd clean it, you'd dress it, you'd medicate it, and you'd follow it to make sure that it healed up. It's the same process that's happening in their mouth. So if that infection in their mouth does not get cleared up, does not get followed, does not get cleaned out, it will spread and become worse, just like that infection on your arm or leg. So healthy mouth can reduce so many things. And here's a list of just some of the things that can be reduced by a healthy mouth: heart disease, pneumonia, diabetes, Alzheimer's, cancer, preterm birth, malnutrition, rheumatoid arthritis, and maybe COVID as well. It's still a question mark. So now we're going to talk about the connection between diabetes. So patients that are diabetic that come in, their blood level sugar indicates what kind of mouth they have. If I see someone that has a really good A1C score, their blood sugar is under control, it usually reflects in a good standings with their mouth. They have good oral care. Same thing, if they're diabetic and it's not controlled, they usually have inflamed gums, they have some kind of periodontal pocketing problems, lots of deposit, lots of plaque. And like I said, this is a strong predictor. The gum disease is worse with the people that have uncontrolled diabetes versus the people that are controlled. So aspiration pneumonia, big ticket item for nursing homes. So just like before, we talked about that bacteria and that infection that's sitting in the mouth that's not getting cleaned out of there. Those particles can be aspirated into the lungs. Once that happens, that aspiration pneumonia, that bacterial infection in the lungs begins. So as you know, it's the #1 cause of nursing home deaths. And it's so crazy how oral care can reduce mortality, hospital stays, and save so much money just in oral care when it comes to aspiration pneumonia. So this study was done, and this slide has a lot on it, but important things to note is at the top is kind of the breakdown of what happens. It's the perfect storm. So you have the bacteria and the virus in the oral cavity, it gets aspirated into the lungs, and you've got an immune compromised patient. And then through this study, they did some modifying. They educated the staff, put in some protocols, and they made sure they had the right supplies. And then in between 2012 and 2014, they saw all of these changes. And I think this is pretty amazing, how many cases they avoided, lives that were saved, and the money that was saved. And keeping them out of the hospital was just astounding. So this just goes to show how impactful oral care can be with a situation like aspiration pneumonia. So with COVID's a big question mark right now. There's still a lot to be studied with oral care. And since COVID's still so new to our society, that right now there's studies underway with COVID and oral care and aerosols and droplets and all of that. So it's still being figured out. But obviously we know it's in the mouth, we're going to harbor these bacteria, and we know it's a respiratory infection. So same kind of connection there. So things to look for. So obviously, sore throat has been one of the signs. There's so many signs, and each person has different signs. But one thing that we have found is this rash that's inside of the body. About 1 in 3 patients are getting this rash. And if you have a patient that has a cold in the nursing home and you're wondering, okay, is this a cold? Could it be COVID? One thing that you can do is look for this rash inside of their mouth. They may or may not have it, but one thing that will affect their COVID test is if their bacteria level is high inside of their mouth, if they have a really poor oral condition, it can produce these false test scores. And so therefore you want to make sure the mouth is as clean as possible before you do that COVID test. So the kind of, again, the association there would be that if you have periodontal disease, if you have gingivitis, you have that inflammation response in your mouth, that same bacteria and viruses can be aspirated and it'll infect your lungs, right? So if you have someone that's already at risk for pneumonia and then you put COVID on there, the impact is not going to do this person any good. And so keeping their oral health as good as possible, as his mouth as clean as possible, will help them hopefully overcome COVID and make their symptoms a lot less. So protection. Here at the dental school, we are covered head to toe. Wear, depending on the procedure, pretty much for all procedures, we wear like a head bonnet, a surgical cap. We wear, for aerosol procedures, we wear N95, a mask over the N95, a face shield and safety glasses, a lab coat, and then depending if your procedure is surgical, we even wear booties on our feet. When you're doing oral care at the nursing home, these are the things that I would do for sure. I would definitely make sure you have a face mask and gloves on. I would make sure your eyes are covered as well, some kind of safety glasses, goggles, or face shield. And because as you know, even though you're not performing a dental procedure, with toothbrushing, it gets messy. Things fly, splatter, um, spray comes off the toothbrush. You don't know what kind of situation you're going to be. So make sure your eyes and mouth are covered. Here at the dental school, we have patients that can are able to rinse. If not, we toothbrush the hydrogen peroxide on. There's 2 options to do this pre-rinsing, pre-brushing. There's either the chlorhexidine or the hydrogen peroxide. If you do not have this available, this is not mandatory. This is a recommendation. And basically the reason that we're doing this is just to lower the bacterial level in their mouth before entering the oral cavity. If your resident has an alcohol-free mouth rinse that is antibacterial, this is something that you could use on their toothbrush to brush initially to lower that bacterial level before proceeding with brushing. And then obviously you want to wash your hands. You want to wash your hands before and after. Remove your, obviously you're going to have your gloves, remove your gloves, and then make sure you use a hand. If the sink is not available, make sure you use hand sanitizer. So now we're going to look at conditions, normal versus abnormal. So with any of these findings, it's so important to assess the patient, observe it, refer it, and report. This will protect yourself and it will protect your resident. You need to ask yourself those questions. Is this the first time I've ever seen this? How long has this been going on? Is it here at my next shift? Speak up, have someone help you come to these decisions, help you report this, help you observe this. All of these steps are so important to, like I said, protect yourself and the resident. So when we're at a nursing home, we're looking at a whole bunch of different things on the resident. We're looking to see how well their dentures fit. Do they have teeth? Do they not have teeth? What's their tissues look like? Are they abnormal, normal? Do they have lesions? Do they have broken teeth? Do they have cavities? What's their gum tissue look like? Is it inflamed? Is it bleeding? Do they have any kind of mouth pain? Do they have any facial swelling? Are we not able to examine them? That's very important to note as well, because we need to note, were they not able to have a dental examination, or did they refuse dental care? And if none of these were present, if they were completely normal, within normal limits, that is important to note as well. Here is a dental screening sheet that was used in the past, back in 2004. And this was a way that you could score your resident. There were the categories on the left, and then there were scored 0 for healthy, 1 for changes, and 2 for unhealthy. And after going through the process of the screening, you tallied your score, and then the score would then let you know whether you were supposed to refer, what the next step with that treatment was. And you notice at the bottom, when it has a couple of items there, it says refer person to have dental examination by a dentist. Obviously, if that was the case, you would do that. There's a lot of times where we'll see a resident that has multiple dental needs, but their POA or their guardian will refuse them to have dental care. And again, that's something that's important for us to note, because even though we find cavities or broken teeth or even infected teeth, if their POA will not give us permission to do treatment, there is nothing that we can do on that resident. And if there's interventions that need to be done, also this would happen at this time of the screening. So now we're going to talk about what's normal and what's abnormal, and we're going to start with the lips. So on the clear left, we notice that we see light pink. Light pink is going to be important to note throughout this whole presentation. So their lips are going to look light pink, they're going to look smooth, and they're going to look moist. Changes that can happen with elderly patients, they get dry lips, chapped lips, and their lips become red in the corners. What's important to note is when those corners they go from chapped to they've broken open. Once they've broken open, like you see at the top of that third slide, they've broken open, they've scabbed, they've changed into appearance. That's no longer what I'd consider a dry chapped lip. You now have a fungal situation in the corner of those lips that need to be treated. And so if that is the case, that is something that your medical doctor can look at as well when they go to do rounds. And there's a medicated cream that would be used on those corners of the lips. And it's called angular colitis. And it happens very frequently. And it does not just happen to the elderly. It can happen to all ages. But wintertime, especially in nursing homes, you'll see more of this because the air is drier in the nursing home. And they suffer from dry mouth anyways. So important to keep those lips moist. And that right-hand slide, you're going to see that middle slide, you're going to see something that looks like, it's like a raised bumpy area. That would be a lesion that we want to note. That's something that is one-sided. That person did not have it on the other side of their lip. It's in one spot. It has kind of unusual borders. It's bumpy. The colors are unusual. That is something that would need to be taken care of, to possibly have a biopsy, refer to a medical doctor, dermatologist, so on, oral pathologist. So something to note to make sure this person does not have oral cancer. And then the bottom slide is an ulcer. This can be an ulcer for different reasons. It can be an ulcer because of, just the same way that we get abscess ulcers. They come and go. It can be an ulcer because they're traumatizing themselves by the way their teeth are coming together. They're biting that spot. Or it could be a denture that is rubbing and not fitting correctly and causing an ulcer. One thing you have to keep in mind is how long has it been there? Is it been there for less than two weeks and it's gone away? No big deal. If it's past that 2-week mark and it's still there, something that you need to report and monitor. I would report and monitor it the first day, but you need to get time to see if it goes away, because there is things that come and go. But with those ulcers, where especially if you have a denture patient, that's pretty much a good sign that their denture isn't fitting well. And that's something that's not going to go away until they get their denture properly fit. So natural teeth. So on the left-hand side, again, we see that light pink tissue. The teeth are in uniform. Teeth do not have to look beautiful to be healthy. These teeth are just look uniform. They're all nicely, shaped. They're not broken, chipped. Um, like I said, the gum line looks pretty uniform. And then you get to the middle slide where you see, okay, we've got decayed teeth, we've got broken teeth. On the very bottom slide, in the middle row, you'll see at the back that used to be a molar, and those are root tips where a molar was once at. And then on the right-hand side, you'll see it's a perfect storm of everything. You'll see decayed teeth. You're going to see inflamed gums. That second slide on the right-hand side, the middle one, you're going to see all those little triangles out of their teeth towards the gum line. That's all what we call root decay. This is very I don't want to say popular, but very common in elderly patients to get what's called root caries versus decay on the tops of their teeth. And then that bottom slide on the right-hand side are people that have had decay and their teeth have broken off and they have all these little stubs. And you can see that there's, the one piece probably looks pretty sharp as well. Now, if you're wondering, okay, would these people be in a lot of pain? Maybe, maybe not. Like for instance, the bottom slide on the right, those teeth could all have already died a long time ago and they don't have symptoms anymore, but they just have these teeth that need to be assessed in some degree. The top and the middle slide definitely the patient could be in pain. So now we're going to talk about the tongue. So again, light pink. That tongue is light and pink and it's moist. That is a good tongue. That middle slide, you're going to start to see changes when the tongue is drier, it's fissured in appearance. And that bottom slide in the middle, important to note why that tongue looks so much whiter in color is that tongue has a bacteria buildup on it. And you can see towards the back of the tongue, it almost kind of turns brown. This is someone that's not getting their tongue brushed. And so they have a bacteria buildup on their tongue. And so they're starting, you can see that fissure. So they have a little changes in their tongue, but then their tongue's not getting clean. And the right-hand side, you'll see somebody on the top that has severe dry mouth. They have that red inflamed tongue. This is someone's tongue that probably hurts. It probably hurts to eat, drink. If you ever burnt your tongue really bad and that day where it's burnt and you're just like, oh, it's like everything's just a real chore to eat or drink. That's what that person feels like every day. They have a super dry mouth. You can see in the corner of their lips, they have that angular colitis going on. The middle slide is a trauma. It's where someone's bit their tongue and it's ulcerated. Again, you'd want to follow that, make sure that heals up. And then that bottom slide is what we consider a white lesion. Again, you're going to see it's kind of has bumpy borders. It's probably not anywhere else in their mouth. Again, that's something that you'd want to report, follow, and make sure that there's a follow-up with that. And with that white lesion, they're showing, it's hard to tell, but that's the side of the tongue. On the tongue, lesions most likely show up on the side of the tongue versus the top of the tongue. So it's good to check when you're in their mouth. You can either move their tongue side to side with a piece of gauze, or if that resident's able to tell them to move them to their cheek to cheek, you can do that too. Gums and tissue. So again, on the left-hand side, we're looking for light pink, healthy. The tissue looks uniform again. That middle slide, you'll see the top slide has these red rings around the teeth. So you'll see all that plaque and debris, what's causing that inflammation, that gingivitis, that acute response. And that middle slide, you're seeing a little bit of everything. There's some inflammation, there's decay, there's the plaque. And then the bottom slide is showing you a tissue of a denture patient. And this is where a denture has been rubbing the patient and they probably don't wear their denture anymore because it hurts. The right-hand slide is talking about all sorts of problems. So the top slide is someone that has a yeast infection in their mouth. And if you're wondering, well, how can I tell if it's a yeast infection? Because a lot of elderly people will eat a lot of foods that look white and it's with throughout their mouth. So the key thing to do is, does it wipe away? Can you wipe that out? So when you take your piece of gauze, are you able to wipe that out of their mouth? If not, then it's probably a yeast infection. And again, this would be treated by a mouth rinse or a cream. The middle slide is showing you everything. It's showing you the gums are red. It's showing you that tartar, that hard deposit buildup, plaque, gum disease. And then the bottom slide is showing you a yeast infection under a denture, and that's called denture stomatitis. We'll get into that in just a little bit. Next, we're going to talk about saliva. So saliva, the goal is to have a moist mouth where you feel like you can talk, there's water flowing through your mouth. There's no problems with saliva. The middle slide is what I call ropey saliva. So this is where a patient still has saliva, but their saliva has changed in consistency. It's gone from that watery substance to a thicker substance. And you would think, oh, well, maybe this will be easier to clean their teeth because it's thicker. And no, it almost is a magnet. It's a magnet for food. It's hard to get the teeth cleaner. It's so thick, it feels like, if you've ever, I'm trying to think about if something that I've even drank, but I know, like, for instance, when elderly patients have real thick medicine, it's kind of hard to swallow, and it feels just like it's everywhere in their mouth. Kind of the same thing with that saliva. And then on the right-hand side, it's showing you someone that has pretty severe dry mouth. Again, it's that fissured tongue. It's the cracking in the corners of the lips. And on the bottom slide, this is someone who is severe. So they have the chapped lips, the corners of their mouth are very infected. Their tongue, you can see, is very inflamed and red. And obviously they have teeth issues as well. And the less saliva you have, the higher risk you are for cavities, because you don't have that natural cleansing, which we'll get into in just a little bit. So anything that you're not sure about, like I said before, just report it. This will help keep you safe, keep them safe. There's not ever going to be a time where you reported something and somebody's going to say, oh, I wish you wouldn't have reported that. Just report it. So why is that saliva so important? We're going to talk about all the things of why it's important. So obviously, if you can imagine, if we didn't have saliva, how hard it would be to swallow, for instance. And it does so many more things than just help us swallow. It helps keep our mouth less acidic. It strengthens our enamel. It helps in that remineralizing process. And also, it's really hard to talk and to swallow and taste foods if you don't have saliva. And so causes of dry mouth, which is also called serostomia, many reasons. Medications. There are, I couldn't even tell you, probably thousands of medications out there that cause dry mouth. And most of the nursing home patients are not only on one, but multiple medications that cause dry mouth. People that have cancer treatment, radiation treatment, that process just really zaps their salivary glands and causes them to have severe dry mouth. Dehydration, obviously, alcohol use and smoking, mouth breathers. If you have a resident that's a mouth breather, they are always going to have a drier mouth, and they're always going to have redder tissues, and they're always going to have some bleeding with their tissues, bleeding with their brushing, and that's just because their tissues are dry, and it's that response. So don't feel defeated when you're brushing their teeth and you think, I do a great job, I do oral care on this person every day, and they still have inflamed tissues. The mouth breathers are never going to have perfectly healthy tissues. And age. The older we get, the less saliva we do have. So oral care products, we're going to talk about that next, and load up here some things that we can do. So you have to decide at your nursing home what is going to work for you. There's all kinds of products on the market for dry mouth. There are obviously sugar-free gums and mints. There's cough drops, hard candies, and then there's more specialty products. Most nursing home residents are not safe to use gums, mints, and cough drops, but I will give you some tips on if they are able to use these things, what to look for. So one, with the gum and mints, you want it to be sugar-free, or something with xylitol. Make sure that they brush their teeth regularly, because like I said before, not having that extra saliva in there, it makes them at higher risk for cavities because they don't have that natural cleansing mechanism. If you're going to use a cough drop or hard candy, make sure it's sugar-free. If it's not sugar-free, they'll tend to put it in the same spot all the time, and then you will have a cavity on the side of that tooth that they always place that cough drop on, or that candy. And then specialty products, big brands out there, Biotene, Oral Balance, Act. A product that I really like to use for the nursing home residents is by Oral Balance. It's a moisturizing gel. We give it out here in samples and packets. I think in the store it comes in a tube. You can find it at Target, Walgreens, Walmart. It'll just be right there with the other dry mouth supplies. The best place to find specialty items is definitely one of the big drugstores, because that is their thing, is with each category that they carry the most in-depth variety. So for instance, oral care, you're going to find more variety, more brands, kinds in a drugstore than you will at a Target or a Walmart. And so this Oral Balance, it comes in a tube. It's clear. It's like a clear gel and does not really have any kind of taste to it. And basically you can squirt it. If they use it, they squirt it on their finger. If you use it, you'll squirt it on your gloved finger. And then basically you just swab it along their tissues. And then I put some on their tongue as well. And they can use it as many times a day as they want. They like it. Their mouth feels refreshed. Like I said, they do not complain about the taste, and you can't screw it up. You can't say, oh, I put too much on, or I didn't put enough. You just, squirt some on your finger and you're fine. So signs of people, if they're having oral problems, what to look for. There's many different things that could happen. So one, obviously weight loss, because they're not eating the way they used to. All of a sudden it's mealtime. They used to love mealtime, and they're either refusing to eat, don't want to go to the dining room. That would definitely mean something's going on with their health and possibly their oral health. All of a sudden they change their food preference. They were someone that would eat anything, and now they only want soft foods. If they have somebody that all of a sudden is touching their cheeks, or they're pointing at their mouth, or showing something like they're fidgeting with their mouth, that could also indicate that they may have a problem in there. Look at them straight on. If their facial features are equal, that is good. If you notice swelling on one side versus the other, that is not good. They probably have some kind of infection. And if their cheeks are warm to touch, that means that possibly could be some kind of infection. If all of a sudden they won't wear their dentures anymore, that also is the sign that either they have a tooth problem, if it's a partial, or there's rubbing of the partial or denture, all signs that probably something's going on. And bad breath. So bad breath, there's bad breath, and then there's the infection bad breath. And I try to explain it as, when you encounter somebody that has bad breath, you're like, yeah, they have bad breath. And then there's this bad breath that like stops you in your tracks. That's the bad breath that I'm talking about. It's something that you'll be like, whoa, I have never smelled that before. This like knocks your socks off, and you're like, man, this is the only person in the whole nursing home that smells like this. That is probably due to a tooth infection or gum infection. So the goal here is to take somebody that has food debris on their teeth and get their teeth brushed. An important thing to note about this slide is that obviously you see there's some bleeding around the gums. All the time I have people ask me, well, I was brushing their teeth, but then this bleeding occurred and I got scared. So I think I'm brushing them too hard, or I stopped brushing. And that bleeding response is the normal response in the mouth if there's something they're irritating it. So if that that inflammation, that irritation, when that's getting cleaned away, that's the body's way of cleansing that area to begin the process of health. So you have to go through some days of this bleeding process to get to where it doesn't bleed anymore. So don't think that it's you or that you've caused this. That's just what has to happen to clear up that area. So now we're going to talk about denture care. So denture care, just as important as cleaning your teeth. So I know a lot of people think, oh, I've got dentures, I'll just throw them in a cup. This is easy, there's no care to dentures. Dentures build up bacteria just like teeth build up bacteria, and it also can cause problems in the mouth, just like not cleaning your teeth. So here is a pair of dentures that were found in a nursing home that had not been cleaned. And so as you can see, just like teeth, they have plaque on them, they have food on them, and they have hard deposit. So you can imagine what this person's tissues look like that this came out of. So here's that denture stomatitis, that yeast infection. And again, that's from that unclean denture, that person that's not getting their denture cleaned. So just like teeth, their dentures need to be brushed with a denture brush. And if you don't have a denture brush, you can use a toothbrush. It'll be fine. You brush the outside, you brush the inside. If you don't have a special denture cleaner, you can use water if you need to. If you have a denture cleaner, you can use the denture cleaner, but don't just set the denture in a cup with water or the denture cleaner. You actually have to use some scrubbing action to them. If you put so the dentures need to be out at night. Another problem with this picture is that this resident is not also probably taking their denture or partial out at night. And so therefore, that's another reason this yeast infection can happen. Their denture and their partial needs to come out at night. It needs to go in that denture cup with that water or that antibacterial solution that they're putting them in. So that solution also needs to be changed regularly, and the cup itself needs to also be wiped out. So it can be wiped out by like one of those antibacterial wipes. So whenever any patient brings theirs into the college dentistry, I clean their partials, I clean their denture cup, the whole gamut. So pointers and tips. So obviously you guys know your residents and you know what works best for them. Selecting the time of day and the location is key. If I try not to disturb people when I go right before their favorite activity. So I'm not going in to do their oral care or to clean their teeth when they're on their way to bingo, because they're not going to be too happy with me. For instance, some people like distraction, whether it's singing songs or telling them a story. One thing that I do with someone who is a combative resident is, one, I try to talk to them like almost ignoring that they're being combative. And the other thing is that if they show any signs of cooperation, even if it's they're opening their mouth and still screaming at me, I compliment them. And they might think I'm crazy. They might look at me like I'm crazy because they know they're not cooperating. But it's distracting enough that they're like, what's she saying? I was being good. And it almost distracts them enough that they're better. But just make sure that the people that are doing a good job, compliment them, but the people that are giving you havoc, make sure that you compliment them and keep it going in a distractive way. And so one big role as a direct care worker is to decide who needs to be prompted, who needs to be assisted, and who can perform daily oral care themselves. This is a struggle because you will have residents coming into the nursing home who may come into the nursing home as an independent resident, someone that can brush their teeth and may even still brush their teeth well. But there's going to come that day where they can't do it well anymore. And how do you figure that out? Well, I feel there's a couple ways that you can do it that are kind of discreet, because some people don't want to, one, be bothered, and some people it's a pride issue. So one, you have to decide, A, do they have a toothbrush in their bathroom? Because obviously if they have a toothbrush, that's one step closer that they're doing oral care. And believe it or not, I've stepped into bathrooms where there's no toothbrush, and I ask the resident about their toothbrush, and they'll say, oh yeah, I haven't had one for a couple weeks. We got to make sure they have a toothbrush, because one, they lose them, or two, their roommate steals them, or the roommate gets mad and throws theirs away. So make sure they have a toothbrush. Number two, is that toothbrush wet? If you come in at 10 o'clock in the morning and the toothbrush is still dry, that would be a key sign that they're not brushing their teeth. And also, like, is the toothbrush tube ever getting any smaller? Is it always full? Things like that. If you come across that and you find that they've not brushed, go ahead, get their toothbrush set up, and just hand it to them and say, hey, it's time to brush. You don't have to ask them about any more about if they brushed or anything else. Just have them brush. Obviously, you want to follow any recommendations that we give you, and watch closely to see if there's any of those changes. Everything we talked about today, the lips, the gums, the teeth, saliva changes, eating changes, all changes. And observe and report any problems to your supervisor. So it takes all of us to make this happen. Every one of us in some way affects how we're going to get people to that end goal, which is good oral health. And so communication throughout these teams of what you need from each person is very important. If you need dietary changes, obviously the nutrition people come into play. If you have someone that all of a sudden is not able to brush their teeth in the same way, does their toothbrush need modified? Do you need an occupational therapist to come in? Do you need a dental consultation? All these different people. And the end goal is to take someone that has a problem and to work on their brushing and then get them into a healthy state. And this slide talks about a Surgeon General's report back in 2000. This was the first report out that made the link between oral health and overall health. So we haven't been at this topic too terribly long. We are still unfolding with this topic, learning new things every day. And I hope that you guys have learned some things today that will teach you that connection. So like Mary Ann had said in the beginning, there are many classes offered by Mouthcare Matters. There's a 1-hour course, there's a 3-hour course, and an 8-hour course. We are working on also some more Zoom courses for Mouthcare Matters. If you have any more questions, feel free to contact Mary Ann, and her information is listed right here, and also Iowa Caregivers. Thank you so much for participating today. I hope you learned some things about oral health, and we will see you next time.